Let's go ahead and get started. We've got a lot of exciting things to talk about today. Welcome to today's webinar, Workplace Wellness and Active Commutes, brought to you by Get There Oregon and our partners, including Providence Health and Services, Metro, and the Westside Transportation Alliance. Pandemic-related staffing issues and worker shortages have made one thing clear. Supporting your employees' physical and mental health are as important as ever. Employers can play a vital, positive role in creating workplaces that foster and support employee well-being, workplace wellness, promoting healthy lifestyle choices can improve your employees' overall health, plus increase retention and productivity, improve morale, and even help attract new employees. Over the past few years, many employers have sought new ways to support employee wellness that includes active commute options like biking and walking. During the pandemic, in particular, bike commuting has grown in popularity. So today you'll hear from local experts with Providence Health and Services, Keen Footwear, and Kittleson and Associates on how to grow your employee wellness efforts by supporting active commuting. First, a little about myself. I'm Kelly Bantle with Get There Oregon. That's spearheaded by the Oregon Department of Transportation and our local partners to help employers and commuters shift commute habits and work practices one trip at a time to help keep Oregon moving. A few house rules so everyone here can have the best webinar experience. Closed captions and Spanish translation are both available. Instructions on how to turn on these features are provided here. If you have any technical difficulties, please let us know in the chat and someone will assist you. And also, if you have any questions, please put them into the Q&A. We'll pose those questions to our experts at the end of today's webinar. So let's take a look at those poll results. Here we go. So employee wellness has grown as a priority for my organization. A large number, 63% saying yes, and then as well, looking here at question 2, my organization currently offers active commuter support and benefits. Actually, quite a few saying no. So we hope to provide some tips and strategies here today to help that along the way. And so let's dive in now to our webinar. I'd like to introduce our panelists. First, we have Stacy Brown, Senior Wellbeing Consultant for Providence Health and Services. Stacy, please introduce yourself and tell us a little bit about what you do for Providence.
Sure. Good afternoon, everyone. I am a graduate of Purdue University with over 20 years of experience working alongside executive teams and employees to help build a culture of well-being in both corporate and hospital settings. As an established preventative health professional with a background as a health coach and health promotion specialist, I have an enthusiasm for helping others to live healthier and more productive lives. In my current role as a senior wellbeing consultant at Providence, I help design, plan, and implement our wellbeing strategy. I oversee our wellbeing communications across the organization and collaborate with key stakeholder groups to help build a culture of wellbeing, and hopes to deliver on our organization's promise to our caregivers to know me, care for me, and ease my way. Thanks for having me this afternoon. I really look forward to today's discussion.
Thank you so much, Stacy. As well, today on our panel, we have Sebastian Garcia. He is the HR Workplace Experience Assistant with Keen Footwear. Hello, Sebastian. Great to have you on the panel. Please tell us a little bit about what you do at King.
Hello, everyone. My name is Sebastian. I am an Indiana University grad. I am part of a team that is in charge of coordinating day-to-day events here at Keen, anywhere from happy hours, executive meetings, building tours, gatherings, etc. I'm also a champion of well-being here as well. Yeah, well, I'm happy to be here.
Thanks so much, Sebastian. Great to have you. And our third panelist joining us today is Nick Gross. He serves as the senior planner at Kittleson and Associates here in Portland, Oregon. Nick, please introduce yourself.
Thanks, and happy to be here. So yeah, my name's Nick Gross. I'm a senior transportation planner with Kittleson and Associates. Kittleson is a planning and engineering transportation consulting firm. We are located in Portland. We also have an office in Bend and several others around the country and the state. My role or area of expertise is in active transportation planning and design. So very much on the infrastructure side of things in the built environment and with a more focus on urban areas. When I say active transportation, I'm referring to people walking, people biking, people roller skating, skateboarding, even using scooters, and we consider active transportation access to transit as well. So that's a bit of the role I play, and my goal and drive is really to get people to choose healthy options for their commutes or healthier options for those short trips that they might otherwise be making by car. And we do that, and the goal is to design infrastructure to make it safer, more comfortable, and less stressful to do that. So that's a quick introduction for me. Thanks.
Thank you so much, Nick. We are just thrilled to have all three of you on our panel today. So starting off our discussion for all of our panelists, what types of active commute support, benefits, or even on-site services do you offer your employees? And can you talk a little bit about the benefits as well as the services that you provide? How about we started off with Sebastian?
Yeah, so here at Keen, I think primarily we find it very important to provide an infrastructure for our employees to be able to commute in an active way. For example, having ample bike parking. We actually provide showers for all of our employees as well. So we have a whole locker room situation downstairs. We offer bike pumps, bike tools. We also reimburse, we have TriMet passes for all of our employees that live a little bit farther away than the Portland metro area. So yeah, we are taking steps to making it a little bit easier for our employees to commute to work in non-car ways. We also do offer a $500 reimbursement towards any bike purchases. So that's been very popular for our employees. Bike pumps, bike tools, any of that stuff. So yeah.
Stacy, how about you? What is Providence doing in terms of providing tools to employees to help them access and use active commutes?
Sure. Well, Providence in Motion is the name of our active commute program. As in the name of our well-being program is called Choose Well. Choice is extremely important when we think about not only the active commute program, but other programs that we offer. So just as Sebastian mentioned, we offer bike cages, lockers, showers, free transit passes. So for those caregivers who want to make that choice to commute in whatever way that looks like, that could be carpooling, that could be riding their bike or walking, or it could be taking transportation, public transportation. We want to make that easy and easy for them. Some other programs that we offer as well are on-site gyms, fitness classes, daily meditation. We have some on-site therapists in some of our locations as well. And also with COVID, we have about half of our workforce now working remotely. So commuting looks different for half of our workforce now as well, and providing that as an option if they want to continue that hybrid work, go into the office some days a week and stay home other days, or go fully remote where it makes sense.
Thanks, Stacy. And Nick, what about Kittleson?
Yeah, a lot of what's been voiced already, but I think primarily on the infrastructure on-site improvements. Several years ago, I suppose it's been maybe 5 now. We moved offices in downtown Portland just a couple blocks, and one of the primary incentives for us in that move was increasing the benefits and on-site amenities to allow for better and more active commute patterns. And with that, we moved closer to a max station. We also we also moved into a building that has secure bicycle parking, access to showers, changing rooms, and bike tools, fix-it stands, some of those things that Sebastian was mentioning. In our office, we've also very much embraced the sense and culture of cycling. It's very much a part of what we do as a firm. But I think in terms of sort of the added benefits and going above and beyond, we also have a lot of photos and bicycle related art around our office. We have a spare bike in the office for visitors from other offices that may be in Portland. We have a number of helmets and other things. And all of this really helps to sort of build more of that culture and acceptance for our employees, so that cycling is not seen as sort of this alternative to commuting, but rather something that's very accepted and embraced and celebrated within our company culture.
So curious, if I want to start by commuting, and I'm not really sure how, to get going, what services can I tap at either Providence or Kittleson or Keene to kind of help me make that change in my lifestyle?
I can take a stab at that. So I think it really maybe depends on an individual basis, but I mean, first, just getting a solid commuting bicycle. And for Portland, of course, we want to have lights and fenders and things like that. But I think your question's probably a little bit further along the lines of establishing, a sense of your commute path and understanding what the most comfortable low stress route would be. I think that probably getting that information probably varies quite a bit in term or depending on the company you work at. But there's typically internal champions, and the advice I would give to our attendees today would be to set up and help support an internal champion so that they can be that educator internally to show people who are interested in commuting by bike or walking or scootering, show them the safe places to commute and what routes or roads to walk and bike on, or maybe to avoid, and also pointing out sort of those higher conflict locations.
Sebastian, any thoughts there?
Yeah, I can't stress that enough. I mean, simply even having somebody in your office that does it and is a little bit more well versed, sort of empowering that person to, whether it be show people good paths or good equipment. I always find that my commutes are, especially here in Portland, as we know, it rains a lot. My commutes are always easier when I have the right gear. So, even things like that, recommendations for gear and again, empowering one or two or several employees. Here at Keene, we actually have a whole bike club. So we send out emails and memos and things you can do, like, hey, here's a good jacket, or here's a good poncho that you can purchase. So yeah, again, on that same route, empowering your employees to sort of help each other out when it comes to that kind of thing.
And I would just echo, I think, what Nick and Sebastian both said. We do have a SharePoint site that we really rely upon our champion network to help supply, just as mentioned, like, here's where all the showers are, here's the maps, here's where you can park your bike, kind of lays it all out. So if you're wanting to know where to get started, that's where we can direct caregivers too. And sorry, when I say caregivers, we call all of our employees caregivers. So I'm trained to say caregivers, whether they being in a hospital setting, that doesn't necessarily just mean nurses or doctors, that's anyone as a caregiver. So just so I didn't mention that one before I started. As well, we also have our well-being platform support social groups. So just as Sebastian mentioned, we have organic groups that have been created for those that are passionate about commuting or biking or whatever that may be. They can connect in that way and share ideas too.
Thank you, everyone. Let's now talk a little bit about how the COVID pandemic has impacted employee health and wellness. Have COVID-related impacts affected your work? Stacy, being in the health space, we'll start with you.
Sure, absolutely. I think from a well-being perspective, well-being has never been more important now than ever. You know, we spent so many years trying to get everyone to listen to well-being, and now we really are at the forefront as you know, following the stress and burnout of many workers that we've experienced during the past, 2.5 years or more. Many leaders in healthcare really have declared this year being the year of healing and rebuilding in our workforce. And so we're doing even more than we ever have done, with a strong focus on mental wellness and overall well-being. So our team really has been focusing on caregiver engagement and retention and recognition. As we've mentioned, I think already here today, our work environment looks very different. We have many caregivers that are remote. And so connection looks different for those workers. We're less able to bring on-site well-being activities like we did in the past. So I'm thinking about new ways to build our culture and caregiver engagement for those caregivers who aren't on-site. And then really thinking about continuing those daily connections and how, you know, those daily connections we found out really are important to keep us grounded in our shared human experience in the face of adversity. So a couple of things that have made us think differently, and examples of that would be our mental health. Like I mentioned, we've spent a lot of time on mental health resources, and being a healthcare organization, we're really lucky to have lots of resources at hand. But that can also be very overwhelming when you are experiencing stress and anxiety, where to start. So we spent a lot of time kind of rethinking about how we simplify access for our caregivers to access the right resource at the right time. So we have a how you've been feeling meter that we've created. So based on just like a pain scale, happy, sad, okay, we have 1 or 2 resources that will direct you to to those resources that make sense for you at that time. And it's been a huge positive influence on our caregivers to know exactly where to go to get started. So we have that one front door that we're sending our caregivers to. Another example that we've done is our core leaders. Our core leaders are a group that are so impactful in building culture of well-being, but they're also a group that's overwhelmed and busy. And so we really wanted to think about how we could ease their way. And so we created well-being care packages. So a way for core leaders to send their team care packages to say, hey, thank you. I care about you. Please take care of yourself. And in those care packages are tangible items that will remind caregivers about the resources we have. So for example, there's resistance bands, there's a touchstone for that represents our spiritual health support resources. There's press pause cards that also tell you about our mental health resources. So not only is it a way for our caregivers to feel recognized and feel valued, but also it's a way for us to reach those caregivers who may not be in front of the computer all day and trying to find those digital resources, but a tangible way for them to hold on to those resources as well.
Fantastic. Thanks, Stacy. Sebastian, what about at King?
Yeah, I mean, obviously, of course, to touch base on that, yeah, we've certainly sort of, I acknowledge that mental health is certainly taking a hit after COVID. You know, the majority of our employees are, again, still working remote at this time. So we are taking steps to ensure that they are staying healthy, even when we're not seeing them every day. We've implemented things like what we call Unplug Time. We encourage our employees to stop working early or stop work at 1 o'clock on Fridays to go out and, you know, enjoy the outdoors and go out and, you know, spend time outside of work to really kind of recharge and re-energize themselves before the work week, following week. Things like, again, the reimbursement, we call them wellness bucks. We literally just reimburse our employees we provide a reimbursement program for our employees to go and spend money on things that make them feel better, whether it be, you know, sailing classes, like I'm taking a sailing class, you know, gym passes, memberships, bicycle related equipment, etc. So yeah, the COVID definitely changed things, but I think here at Keen, we're certainly taking the steps to ensure that we're all staying healthy, even when we're not coming into the office every day.
Thanks. Nick, in particular with Kittleson, you've done a number of studies looking at how COVID has impacted commute patterns. Could you share a little bit about that with us today?
Of course, yeah. For a while, that was sort of one of the bigger questions of all of the COVID pandemic, was how the transportation system would shake out after. And yeah, we've been doing annual surveys to further understand what commuting looks like, and more generally what transportation mode choice looks like now that we're maybe getting to the end of COVID. But I think generally speaking, a lot of this shouldn't sound like super new information, but transit ridership has taken a very hard hit in COVID. I think most people are aware of that. And transit use, the bus, even the MAX here in Portland, all those numbers are down by about 50%. And this is just based on some information that I'm going off of from our last year commute survey. Driving is up a fair amount from where it was, but the bigger takeaway is that more people are walking and biking to work than they were pre-COVID. And that assumes, you know, a little bit more of us fully being back in the theoretical office. So there's been a big shift in percentages of people sort of choosing healthier and more active commute choices, mostly because COVID has limited the options of sort of that tighter space shared commute, you know, on a bus or on a train. So generally speaking, we're seeing the opportunity for an uptick of 36% of more people biking and walking to work, and about 45% of people or less, a 45% drop in transit ridership. So yeah, there's been a big change. COVID has impacted the transportation system quite a bit, and it'll be interesting to continue to monitor these changes and forecasting as we go forward.
Yeah, certainly it seems that we're going to continue to see change in commuting habits and patterns, but interesting in particular that active commutes has been on the up, I think, because of health and wellness. And so let's talk a little bit now about really how does active commuting fit specifically into employee health and wellness, and why should employers offer active commute benefits to employees? And I'd like to kick this question off first to Sebastian.
Sure, yeah. Well, I mean, for starters, I mean, the most obvious one would be, you know, it's better for the environment. It's a much greener way to commute if you're walking or riding your bike, scooter, skateboard, whatever it might be. As far as, you know, how it fits here into our employee health and wellness, I mean, really, we're just trying to create a culture here at Keen where, you know, employees are empowered to commute in different ways. You know, after COVID, I'm sure a lot more people are driving to work, and yeah, we're just trying to do our best to yeah, provide those benefits and provide those structures for our employees.
Stacey, you touched on this a little bit, but how exactly again do how again do active commute benefits fit into employee health and wellness?
Sure. And honestly, a big focus right now for active commute is also around our recruitment and retention. As well, I think well-being in general, all of our offerings that we offer are a big part of recruitment and retention right now. As you know, there it's not surprised anyone that there is a huge shortage in for healthcare nursing. So as we recruit and retain our caregivers, this is a great recruitment tool. In addition, obviously environmental stewardship, reducing congestion in our neighborhoods, are also important. We do offer wellness points towards those caregivers who choose to log their active commute as well. So it's another incentive. There's no surprise that choosing healthy commuting options can improve mental health and physical health, increases in there as well. So it's a big part of our strategy, especially in Oregon. We are a large organization, so we're in different regions. So we are learning, what works in one region doesn't always work in the other region, but we have a strong program in Oregon with our active commute.
Nick, anything to add on as to why employers should put the effort toward promoting active commutes for employees?
Yeah, absolutely. I love answering this question. So I think there's a lot of the obvious benefits, I'll call them. Some have been touched on. There's environmental benefits. Active commuting is almost always cheaper. So there's financial benefits. It's much healthier for you as an individual. It can even be faster depending on your commute. And that just actually reminded me, when I lived in Boston, there used to be an annual commute challenge, and everyone would start from downtown and you'd go to the outside boundary of the city, one person running, one person taking the train, one person biking, one person driving. And the person driving was always the last one to arrive at their destination. So it can certainly be faster, again, depending on where you are. But the bigger benefits I see are definitely more around the social and mental sort of areas. And mostly the biggest benefits I get out of choosing to bike into work by bike are really around the social piece of that. It also serves as this sort of window to decompress after your workday or prepare for your workday, where you're alone, and it's a good sort of just headspace to decompress or get ready for what you have ahead of you. And it's a very different headspace capacity versus being in a vehicle. So a good window, a good transition zone to and from work. And then more on the social side, I have met so many of my neighbors and my best friends and even my wife through cycling. And it continues to be a building block for me and building a sense of community. This morning on my bike ride into the office, I met a father and his son. They were biking to school, and we just exchanged this very nice conversation about them going to school and me going to work. And I feel like you don't get that as much with driving or being in a single occupancy vehicle. You're sort of just alone. So there's an endless slew of benefits I see. Social is, I think, the most underrated, and the mental is also very underrated as well. And then maybe the last one is, I always tend to drink less coffee when I've commuted by bike. And so that's always a plus as well.
And Stacey, you touched on this a little bit. You see active commutes as a recruiting tool. So there are specific benefits really for employers themselves, not just benefits for employees.
Absolutely. That's a great tool to say, hey, we offer a free transit pass. We make it easy for you to bike to work, right? And all of those offerings that you get for as being, a caregiver on site. So our recruiting team definitely uses our well-being programs as recruiting tools. And I love the idea that Nick brought up, the social component of it. To build a culture, those social connections are so important. And I think I learned that even more over these last few years about the importance of that. So, having that connection as you come on board to meet new people or teammates in that way is so important in building that culture.
In a very supportive environment for sure. And Sebastian Keen even showcases commuter and active commute type benefits in your job posts.
We do, certainly, yeah. Much like Providence, we certainly use that as a recruiting tool. We recognize that a lot of our employees do commute actively, and yeah, we like I said, we make it easy for them, and we try to showcase that so they know, so we're here to support them.
So let's get into our final question. What guidance would you give employers looking to build up their employee wellness efforts and programs by promoting active commutes? Is there like a good place to start? Stacy, I'm going to kick it first to you, as you have been the architect of many of Providence's programs.
Well, gosh, I guess, to build a program, it's probably a two-part answer. One, knowing what the organizational needs are will help guide where to start. So the example of active commute, are we trying to reduce parking? Are we trying to reduce SOV percentage to meet requirements, reduce congestion, use it as a recruiting tool? What's the goal? And then two, understanding what our caregivers want or our employees want. You can build a great program, but if our caregivers don't see value in it, it's really a waste of time. So surveying to know, how far they travel, what options would they like, what do they want to see, making them part of it, building that champion network so that their voices are heard. And then once we have a good idea of those goals and what we're trying to build, what's the budget? We can come up with a lot of great ideas too, but we have to have the budget to support it. So, and then also, as I started off today's discussion, choice, to provide choice for our caregivers, to make sure that there's something there for everyone. We have a great active commute program, but what about those remote caregivers who don't, have the opportunity to bike to work? And so, thinking about what virtual options are we going to provide along with that, that option that would, for those caregivers that go into work. We are still building out this program as well. So, I think also knowing that there's learnings along the way and be willing to be flexible and change things along the way as for our organization, word of mouth is a big, is probably one of the biggest ways that our programs are promoted. And so having that group of champions is so important.
Thanks, Stacy. Sebastian, to you, this question, and maybe you could share some thoughts in particular on like basics and essentials that can help build a foundation.
Yeah, I mean, like what Stacy said, I mean, really it's just finding out the needs of your employees and making sure that those needs are met. The majority of our employees bicycle into work, so we provide bicycle storage and bicycle safe storage for them to keep their bikes. Having tools, having even employees on hand like myself that are able to work on bikes. Really just understanding those needs and doing the best to meet them. And then again, budgeting kind of comes into play. And then having an end goal as well, obviously, reducing parking, et cetera. So, yeah.
And when you say tools, you're talking about like
physical tools, like actual like bike pumps. We have, I noticed one of the questions was asking about storage. We provide a locker for all of our employees. So if you are biking into work and you have, you're all wet from the rain. You have places for you to store your gear, etc. We have, shoe dryers, little things like that that might get overlooked, really go a long way if you just ask your employees or your employees and kind of get that information. Yeah.
Nick, any thoughts here on some basics and essentials that employers should consider?
Yeah, a lot of what's been touched on already. I think it really just comes down to breaking down the physical barriers and the cultural internal barriers of commuting by bicycle. So all the on-site improvements that Sebastian has mentioned, going above and beyond just the bike storage or bike parking, but having the stand to fix a flat, or shoe dryers. I'm going to be talking to HR about that after this. That's a great idea. But also just to be in the mindset about or not being in the mindset that we don't have a lot of people who bike to work. It's much more of the build it and they will come mentality that I would advise and push. And so if you do have a secure bike parking, you do have the necessary tools to fix a flat, you do have lockers and a shower, and that at least allows people to make the choice to commute by bike. If you're not providing those things, then they are forced to drive or take the bus or choose a different option. So there's a lot of on-site improvements. And then on the, again, sort of the softer side of just the education piece of all of the benefits, the physical health, the mental, the social benefits that come along with choosing more active commuting. There's studies that show that employees are just more productive, happier, a lot of those things. And then to round it out, it never hurts to provide a financial incentive as well. So if you can muster up $20 a month or whatever it might be to provide those employees who are choosing those healthier active transportation options, that certainly can't hurt.
Fantastic. Those are great insights there in how to get started, but also I really like, Nick, your point that it is often build it and they will come, because if they can't make those choices because of hard stop barriers, like no place to securely put your bike, then it just won't happen. So it really, I think, helps to really pin on why employers need to have a role to help employees make these choices.
Yeah, I did want to add just one other thing in terms of resources. I'm sure we can get this dropped in the chat or at least sent out to attendees. So there is a group called the League of American Bicyclists, and they put out an award each year for bicycle friendly business awards. I think there's a bronze, silver, and gold level. And to meet those tiers, there is essentially a checklist of what you can do as an employer to score more points to get that higher designation of bicycle friendly business. So that's a resource and maybe a good starting point for sort of a checklist of what people might want to strive for. And looks like someone just dropped it in the chat. So great.
Very cool. Yeah, good to have an established framework so that you're not trying to invent from the ether. So thank you so much for that. Let's now jump into the Q&A. We've already got some questions here. I would start it out with, how do you support employees who walk to work? We've talked a lot about biking, but what about walking? Are there any types of financial benefits, wellness credits that perhaps can be extended?
I don't know if who you want to start, but I'm happy to take that from. So we have our well-being platform is kind of how we reward our caregivers, especially those that are on the medical plan, can earn a health incentive every year, and walking, biking, whatever type of activity that you would like to do is supported through that platform. And so you get points every day for walking. And so you would log those points, and those earn you a health incentive each year when you reach certain thresholds of the program.
We have a very, very similar sort of program. Yeah, movement benefits through our health insurance. Again, you get a Fitbit depending on how many steps you walk. That's all money saved. So yeah, very, very similar incentive, I'm sure.
Cool. So burnout is impacting a lot of employees right now. How might active commuting help? Stacy, you want to take this one on?
Well, gosh, I think Nick answered that already for us earlier. You know, there's a great positive impact on biking, walking to work for mental well-being. And so, you know, using that as a way to, you know, disconnect and focus in, you know, have that disconnect time between work and home is super important. So I think that really fits in well there. We, you know, burnout is something that our organization is, we're trying to work through. You know, everyone's readiness to change and where they're at within that scope is different. And so, you know, having tools and resources to meet our caregivers wherever they are, whether they're, hey, I'm feeling really good today, or no, I'm struggling today, has been one thing that we continue to focus on, and empowering our core leaders, making sure that they have the right tools in hand. From a learning and development perspective, working with those teams. From a well-being perspective, making sure that they're aware of the benefits through our employee assistance program and the resources that they have. We've worked really hard to make that one kind of front door for core leaders to kind of know what's going on with well-being and what resources they can get their hands on as well. So I don't have the answer, you know, for burnout, but well-being is definitely part of that solution, and engaging and creating that well-being of culture and permission to take a step back and put self-care as a priority.
And effectively giving yourself permission to take the time to bike commute. So anything else, Nick, Sebastian, to add here relative to a positive impact active commutes can have? Nick, I know you touched a little bit on this.
Yeah, I guess I'd just, you know, again, echo a lot of what I feel like is underrepresented benefits, those being the social and the social health, the mental health. Most people can recognize the physical benefits, but yeah, really, as Stacy had mentioned, there's just an increase in this burnout that has been associated with COVID, and anything we can do to mitigate that through social and mental benefits, which a lot come through physical activity. So whether, yeah, it's walking to work, walking to the bus stop, even walking to a shared mobility device, or biking, those are all proven factors to help mitigate stress, and which all lead to that ultimate sort of idea of work burnout. So yeah.
Yeah, it seems so often that work burnout, in part, at least for me, is that I don't have the opportunity, or I don't take the time to get into the gym. And one thing I've personally found is that by bike commuting in, I'm actually getting that physical activity. And I feel good about that, because otherwise when I didn't make it into the gym, I was always like, God, I'm not even making it into the gym. So, you know, that can really be very frustrating and just kind of drag me down a little bit. So it is hard sometimes to put a specific, you know, pin on these intangible benefits, but wow, they really do, I think, make a big difference. Here's a question. As a non-biker that sometimes walks to work, the biggest barriers for me are weather and gear, and having the right kind of stuff Sebastian, you've touched a little bit upon this. Are there any thoughts for what companies can do in providing like subsidies as part of commuter benefits to help incentivize having the right gear?
Well, I mean, yeah, here at Commute specifically, we do subsidize if you are commuting. I mean, we subsidize some of your gear, I think, to an extent. I mean, as far as what employers can do, I mean, yeah, certainly, as long as you're, again, kind of touching back what I said earlier, just asking and seeing what your employees need and kind of trying to go and above and beyond and trying to provide that for them. As far as, where to get equipment, I mean, it really is just up to your employees, and again, empowering people to sort of have those conversations within each other. But yeah, I think commuting is always easier, of course, when you have the right equipment.
And at Providence, we offer we call it choosable discounts. So we have a partner that helps us manage those discounts. So you can search for companies or brands that you're looking for and get a discount on those, whether it be shoes or apparel or bikes or whatever you're looking for.
Right, to help folks gear up to have that credit, if you will, so that they can, put forward funds for shoes and like rain gear for your bike and lights and things like that. And it just kind of helps to encourage us to, to take those steps, especially I think when we're relatively new.
And, offering rewards, obviously, having that intrinsic motivation, that rewards that could go towards gear. There's great success in offering cash rewards so that your employees can use towards whatever the treat that they want to get for doing good behaviors is definitely going to go a long way as well.
Definitely. Here's a question. How did you initiate incorporating well-being benefits into your health insurance plans? And were there existing options, or did you essentially go to your vendors, your insurance providers, and say, hey, can we add these things on? So a little bit about that process.
Oh, that's a big question. So for what we do, we have we work with our benefits team and our plans, but because we have over 50 different plans within our organization, and so just to streamline it, we have a well-being vendor that we work closely, or partner that we work closely with, that helps us manage the behind the scenes part of it. But depending on what plan you earn or you're on will depend upon what type of incentive that you get. But we really do rely upon our partners to help us on the back end to know who gets what in those file feeds. But really we found our partners, and then we've kind of strategically designed our health incentive plan based on, if you're, for example, we have high deductible plans, we have premium type incentives as well. So the two options you have, whether you're on a HRA or HSA plan, you get money put in your health equity account. If you're not on one of those plans, then you get a bi-weekly premium credit. So really just working closely with our partners to help us administer those, what our strategy was behind our health incentive. A lot of work does go into it, but your medical plans should be able to help kind of give guidance on designs for health incentives or rewards. Some health partner vendors do have options on how you can choose whether you're doing a health incentive towards a medical plan or you're giving cash rewards out. They should be able to give guidance there as well.
Sebastian, how does Keem deliver your wellness credits and rewards? What kinds of systems do you guys lean on?
Well, like I said, we do have movement benefits through our health insurance. I'm not super educated entirely as to how that looks, but I do know that we get reimbursed, health insurance money back depending on the level of movement you're achieving per month, I think. yeah, I don't know. I'm honestly a little over my head on this one, but yeah.
Well, we appreciate that insight because
Yeah.
I think it's a real challenge to say we want to do these credits and rewards, but how do you actually administer them?
Yeah.
That's, kind of a question of course, how do you set things up with your insurance provider, but also too, okay, can you do some sort of payroll integration where if you say are giving some kind of a credit for biking to work for the month or some such, you get $25 and that gets fed into like say your paycheck.
Yeah, either way, relying upon your partners and payroll is so important when you're thinking about administrating. Also, it's going to depend upon your budget, right? On what you can provide. So I guess that's the best place I would start, is thinking about what's your budget, and then who are your partners that you may already have existing partnerships with. I know for the sake of this conversation, it's around, I think it's very easy for us to talk about rewarding around physical activities, but I think it's important to have a holistic approach to it and really think about mind, body, spirit, financial activities when we think about rewarding for health incentive or providing extrinsic motivation to do these healthy behaviors.
So for those trying to encourage leadership to extend active commute benefits, and what are maybe those main what's in it for us appeal points that you think can work? We've touched on this a little bit, but are there any ones any particular, hey, leadership, this is what we can get out of doing this? Are there any specific top points that you think may play the best?
Engagement, retention, recruitment, burnout. Those are all really hot words right now that will get leadership's attention when thinking about bringing on a program like this.
Yeah, so really linking it to those critical business needs. That this is great for employees, but this is also really great for us as an employer because it really helps to improve morale, which really helps with retention. You mentioned employee engagement. Stacy, can you touch a little bit upon what employee engagement means? Because I think that's a term that we're just now starting to hear as COVID impacts have lessened.
Sure. Well, engagement means you're showing up fully present and engaged in what you're doing. It's creating that culture. You're there for more than just being there for more than just a paycheck. You're getting fulfillment. It's what's going to keep you where you are, is if you're fully engaged in what you're doing. And so we have a whole engagement team that helps with that culture build, and we survey every year to find out how we can improve our engagement. But it's so important to wrap well-being up in your overall engagement goals, because it is a critical part in building that culture. So it's a way of how your organization is, right, and connecting to your values and your mission and why you're there.
And also too, the work experience isn't just what happens when you walk through the door in the morning and you sit down at your desk or you get to your workstation, but it's that whole total work experience. Mm-hmm. So we talked a little bit about this kind of menu of different commute options. Commute benefits, that can be extended. And Stacy, you mentioned in particular that you've arrived at some of these benefits by just simply asking employees, that you've done just some one-on-one type research. And Sebastian, I think you've pointed to this as well. Could you guys get a little bit more into the approach you took and how you asked employees, hey, what would you like?
Sebastian, I don't know if you want to kick it off or I will.
Yeah, no, I mean, very simple. I mean, we have a centralized platform where we simply ask polls. I mean, what are we doing well? What you'd like us to do better? What can we do to support you? Very simple. People will talk,
So
And
it's
then,
really, go ahead. I was just gonna.
We have a champion network that we really rely upon. So we connect with our champions once a month. And there's always a button out there that they can always share ideas. Some of our best programs have come from our champion network, but they really are our eyes, our feet on the ground. Like I mentioned, we're an organization of over 100,000 employees in 7 different regions. So we can't be there, and there are cultural differences between each of our locations. Even within Oregon, there's cultural differences between our locations, and so having those champions are a crucial part to the success of our program. And also, it makes a great way to recognize caregivers or your employees using that champion network. Sometimes, as a core leader, maybe you have someone on your team that you want to recognize and reward with something, but you don't have the funds or the budget to do it. Making them part of our champion team is a great way to help with burnout as well, to disconnect them from their normal job, to give them something else fun to do. So we've really been using our network, our champion network, in that way as well, as a way of recognition and rewarding someone to get to be part of something bigger than what they are. And then those champions, like I said, are the eyes and ears on the ground. So we know when something's working, and we also know when something's not working, because they will let us know.
Well, we're right at about the top of the hour. I'd like to thank our panelists for all of their great insights and tips. Certainly these are some big opportunities and challenges. And of course, how do we get things done? And we do appreciate all of your thoughts today on that front. I just want to share with everyone here attending our webinar that we've got some resources for you. We've got a lot of great information on gettthereoregon.org in our For Employers section. And also too, our Get Their Oregon team is available to assist you, to help connect you with information, and as well to provide co-branded materials such as using our Get There Connect, which is a tool that can be used to discover commute options and as well track trips and as well metrics like calories burned and money saved and even CO2 reduced. And as well, we'd also like to encourage you to follow us on LinkedIn. There's a link here, I believe, that we can provide in the chat too. And real quickly, before we sign off, I just want to let everybody know that our annual Get There Challenge is happening October 3rd through the 16th. It's a timely opportunity to help make your employee commutes better. Employees log commute options, trips, and remote work, and unlock achievements to win weekly as well as grand prizes, which I think we all can use a few carrots to help get us going and keep us going. So that is the main aim of our Get There Challenge. Please go to gettthereoregon.org for information, and as well you'll find we have a online employer toolkit that provides ready to use turnkey employee materials, posters, even as well web copy, intranet copy, and emails too. So with that, I just want to thank again the panelists for sharing their insights today, and also to everyone who was able to attend. So with that, thank you and be well.